Hi everyone, welcome to Mission CISD House Calls. I'm Craig Verley, and we're joined today in our set by Dr. Darryl Stinson, who's with Primary Care and Wellness here in Hidalgo County. And we're going to be doing a series of these, hopefully over the coming weeks, on a number of different topics that we hope you will find valuable. This is our first go at it, so we'll see how things go as we go through the program. Today, though, we would like to talk a little bit about kind of like life returning back to normal to a certain extent. We've been dealing with COVID-19 now for a little over 2 years, and it's in the news a lot how everyone's starting to try and make those leaps back towards somewhat of normalcy. And one of the first things that seems to be happening is, what do you do about masks? Okay, we're not required to wear a mask all the time now like we were before. How do you make that judgment call in terms of when you wear a mask, when you don't wear a mask, who should, who shouldn't?
Of course, during the 2 years, it was mandated, and it was pretty easy. We all wore masks. And I think we were trying to get the message out that at home, wear a mask if you have somebody who's not vaccinated. Initially, nobody was vaccinated, but especially the elderly who are or anybody who had a weak immune system, are vulnerable people. And I don't think that was done much, but it was. I think we tried to encourage that a lot. And so it was pretty simple back then. And as we started going on and progressed onto the different mandates and discussions of finding it where people had to make their own decisions about it.
Yeah.
And I think that was a difficult, stressful time. It may not have been a major stress, but it did affect people and made life a little bit harder. Do I wear my mask? Do I look like I'm the only one wearing the mask? Am I the only one not wearing a mask? And I'm pretty sure that was stressful. But currently, most of the world we're transitioning we're post danger from the coronavirus, from COVID-19. It's a whole different type of infection. It's still more than a cold. It still will kill people, but now it's really the vulnerable people and very few of the people in good general health, the current strain of COVID-19. And of course, if all the people got vaccinated, no matter what their health status is, definitely they are very little risk. So the vaccines were a tremendous success. And so I think now the risk of wearing a mask is now, I think not wearing a mask, I have no problem with it. We had this dangerous virus, so I think now we just take our risks like we usually do as we've always lived. We're going to always be with a mask. I don't think we're ever going to change now from here on out. I think it's been part of our culture, and it's a good tool to have for the public. If you're sick and but you're well enough to work, but you're still having symptoms, now you can wear a mask and nobody's going to look at you funny. They're not going to think you have tuberculosis or anything like that. So I think that's a good policy. And a lot of people are very fearful and very anxious to go in public. I think this helps them where they'll probably have a lot more liberties now if they can wear a mask and they see people wearing masks. So I think it's forever changed our culture, at least in our generation, next couple of generations, and I think for the better.
Yeah. So at this point, based upon conditions in the county, because we know this is always going to be something that's going to be somewhat in flux moving forward, if nothing else, we've learned that over the last 2 years of the pandemic. In your mind, who should really definitely be still wearing a mask when they're out in public?
Definitely people who are elderly and unvaccinated. Definitely they should wear a mask when they're out in public. If you're vaccinated, we haven't seen anything nearly as fate that comes close to what we were experiencing back in 2020. The strains are much weaker in that they're more contagious and weaker. Now, people, what do you mean more contagious? when the virus first came out, it was new. It didn't know how to infect humans very well, and it didn't matter what your immune system was. It really, you could be an old person, and the virus didn't know how to, it could be, you could be exposed to it, but it wouldn't get into you because of certain aspects of your immune system, and the virus just wasn't very good at it. But that's always the way these new viruses, when they just first learn how to get into humans, because they know how to get into other animals, but then when they learn how to, they call it novel, and so they're very malicious, they're very aggressive what they do to the host. You gotta understand, these viruses don't like to kill their host. They like to keep the host alive so they can spread it more, and they want, because we're their world, we're their Earth, and so when they start out though, they're not very good at that. And so they get in us, and they cause a lot of death, but they don't know how to get into everybody. Most of the people that come in contact with, it doesn't penetrate and infect them. But that starts changing as they start learning. That's why we had the Delta strain, a little bit more contagious, still aggressive, but not nearly as dangerous. You saw the intensity of the disease go way down by November of 2020, and that was the Delta version. But it started getting more people. So we kept on having a good amount of people that got hospitalized, because a lot more people were getting affected, but again, it wasn't as intense. And then we got to the Omicron version, which is now more of like what coronavirus is like, which is now it knows how to infect everybody. And it doesn't care if you had a strain of it last year. It's changed so much. That's why the vaccine, it didn't stop people from getting infected. Most of my patients that came in during this last surge had been vaccinated, had the booster, but they still got infected. But the infection was much milder for them. But it learned how to get through even the vaccine. But again, it was such a gentle type of infection. Most people didn't know they had it. They would come in. I got allergies. I test them, and no, you have COVID. They couldn't believe it. So and of course, people who were vaccinated, we didn't see any of those people in the hospital. The hospital mostly was full during this last surge of unvaccinated people. So yes, the vaccine didn't help stop the contagion and help stop the spread, but it did stop the severity of it. And we should see even more as this next surges will come. We're going to probably get another surge. Everybody's guessing late summer, fall, or winter for sure, and probably going to be even more spread. Probably infect a lot more people, but it's probably going to be just like a cold. Mm-hmm. Won't get too many people. Even the elderly people won't get that. Won't be dangerous to them.
For parents sending their kids to school, especially when. If they're faced with the decision, masking, unmasking, those types of things, whether there's children or individuals in the classroom with or without masks, should that be a big concern for parents in general now at this point of the pandemic?
As far as in what way?
Well, I mean, we're reaching the point now where we're going to have a situation where more and more classrooms potentially are going to be having children or staff members potentially without masks on at certain times. Should that continue to be a concern for the average parent and child?
In my opinion, I don't think so. I think it's fine to be without masks. Where we're at right now, mm-hmm. we are now pretty much as we were before the pandemic. Yeah. As far as what the disease is causing, and so I think we're fine. There shouldn't be a concern for your child who's healthy to be going out there. If that child that they want to have a mask on, that should help him with that. But even if they get an infection, we don't expect it to be much of a serious infection. Again, remember, we weren't really concerned about the common cold or even the flu. And we didn't need to be too concerned. It wasn't that. It was more of a nuisance of people ill. It did. People did get hospitalized for the common cold and the flu before, but it was random, and so we didn't really feel like we had to keep people isolated from each other. And I think contact is important. I think there is an importance of transitioning the children into this no mask. 'Cause a lot of kids have never been to school without masks. I mean, you got your kindergarten, your first graders. It's gonna be a very strange environment. I'll tell you that you'll tell them, hey, you don't have to go. You can go to school without a mask. You go, why do I want to go to school without a mask? And so I think that's going to be it'll be a transition for both the parents and the educators and the school districts to go through this. And I don't think we have any history of how to go through it. I mean, we're gonna be winging it, I think. But I think if we use our good instincts, and I think we'll be fine.
So as we're moving kind of forward, if things kind of remain calm with COVID-19 and cases and severities and those types of things, how should we be approaching our return to normal, more or less, in terms of our daily lives? What are the things we need to kind of still maybe keep in the back of our head? Or is it just like throw all caution to the wind and just dive in head first?
Yeah, I think we should just go back to normal. This was a pandemic. This was a virus that came out. It was a novel. It was a new strain that came out. It did what we expected. Comes out hot and aggressive, and then transitions to a more contagious and more of a nuisance type of upper respiratory infection. And we've been dealing with that forever. And so we should go back to our normal lives. We should not. There's no reason for us not to. It's done. It's over. The hurricane came and went. Now it's a sunny day, just like, and we've all been through hurricanes here, and we don't have to keep our windows, boarded up once the hurricane's gone. So I think that kind of attitude.
Very good. But at the same time, I know there's going to be those that it's going to be hard to let go of some of those safety blankets at first, but it's okay. Mm-hmm. To be uncomfortable with letting go of some of that.
Definitely. And again, I think this is a good thing in general. There's a lot of people out there that when we went down to these restrictions, they were like, welcome to my world. This is the way I really want to be. And I think it's going to make it easier for those people who are uncomfortable to be in public, because they're more sensitive to getting infections. And I think it'll allow them to be able to wear their mask whenever they want, all the time if they want, for the future. But I don't think but those are only that section. Most populations aren't that sensitive. And again, there's no reason now for us to be masking up and social distancing and locking down or whatever we were doing before.
Unless we're sick and still need to go out in public, then it's something that I know personally I never would have thought of before if I had symptoms of something.
Right.
Wearing a mask out in public. I know there was a certain part of the population that would, and I may become one of those.
Yeah, I mean, I think all of us, I wouldn't be surprised. There'll be a few that won't. But I think most of us, if I'm having sniffles, whether it be allergies or something, and I'm out there, I won't be, because I was always uncomfortable in public when I have, and you're always apologizing, and so now I just put on a mask, and hey, I got a little, I'm under the weather. You can walk into a dinner or whatever, walk into a meeting or something, and you say, I'm under the weather, I'm gonna wear my mask, and I think that's a good thing. I think it's going to stay with us. That's going to be a permanent thing for that kind of behavior.
Yeah, very good. Well, Dr. Stinson, we appreciate you spending some time with us discussing kind of what's going to be going on, probably as best as we can kind of tell with life over the next coming weeks as things start to open up a little bit more. We've got many more subjects to be sharing with you all that hopefully you'll find helpful as well as a part of our House Call series. And until then, we'll see you next time.